Hello, my name is Sandra Olaboden, and today I'm going to be your student nurse. And today I will be assessing your thorax and lungs, your peripheral and cardiovascular system, and your abdomen. So I'm going to begin this assessment by performing hand hygiene, which is either going to be by washing my hands for 20 seconds or using hand sanitizer. I'm going to start off by asking you a few questions.
Okay.
Do you experience any chest pain while breathing?
No.
Do you experience any chest tightness?
No.
Have you been experiencing any shortness of breath?
No.
Are you a smoker?
No.
Do you have any trouble swallowing or eating?
No.
Have you been experiencing any nausea or vomiting?
Not at all.
And do you have any history with any family history of cardiovascular disease or heart attack?
No, not at all.
Okay, very good. So I'm going to have you face with your back facing the other way.
Okay.
And I'm just going to be looking, inspecting your back, and I'm just looking for consistency of skin color with your ethnicity, which that is present.
Okay.
I'm also looking for symmetry in your back. And can you tilt your head downwards for me? Just your head, not your body. Just okay. Okay, and I'm just palpating your vertebral prominence. Do you feel any pain upon palpation?
No.
Okay, I'm just gonna walk down your spine to check if it's symmetrical. Okay. Did you experience any pain?
No.
Okay. Now I'm going to put my hands behind your back, and I just want you to take a deep breath for me. Okay, chest expansion is equal. Now I'm going to palpate your back, and just let me know if you feel any pain upon palpation.
No pain.
Okay. No tenderness or masses detected, and no pain as well. Now I'm going to place my hand on my palm on your back, and every time I place it at a new location, I want you to say 99, okay?
99. 99. 99. 99. 99. 99.
Okay, very good. Affirmative tactile is symmetrical. Now I'm going to percuss your back. Okay, resonance upon percussion. Now I'm going to listen for breath sounds. So every time I place my stethoscope, I just want you to take a deep breath for me, okay?
Okay.
Take a deep breath, please. Again. Okay. Okay. Okay, very good. Breath sounds are clear. There's no sign of vesicular, adventitious signs. Now I'm going to have you move towards face the front now for inspection of the front part of your thorax. Now I'm going to be looking for inspecting your chest, and it looks like your clavicles are symmetrical and skin color is consistent with ethnicity as well. I just want you to lift three, excuse me, yes. And I'm just going to be looking for your anterior, posterior, transverse diameter. I'm just going to look on the other side as well. Okay, and 1-to-2 ratio, which is the expected finding. You can put your hands down now. And I'm going to also palpate your chest. And just let me know if you feel any pain or tenderness upon palpation. Hey, did you feel any pain?
Not at all.
Okay, very good. No pain detected, no masses detected as well. And now I'm going to percuss your chest. Okay, very good. There was resonance throughout percussion, and now I'm going to be listening for your breaths as well. So the same thing, we're going to be doing the deep breaths every time
Okay.
Okay, very good. There was no signs of adventitious signs, and that will be the conclusion of your thorax and lung assessment. Okay, and I actually noted that I forgot to check for your the angle of your ribs, so I'm going to assess that. And it's at a 90-degree angle, which is the expected finding. And I'm also going to take your pulse. So I was actually checking your respirations, not your pulse, and you did fall under the expected finding of 12 to 20 breaths per minute. So now we're actually going to now begin the cardiovascular, excuse me, the cardiovascular and peripheral assessment. So I'm going to first start by checking pulsation of your neck. And I'm going to be looking from your suprasternal notch to check for. And there was a slight pulsation at your jugular vein. And I do want to state that this assessment is supposed to be on semi-Fowler's position while you're laying on your back at a 35 to 40 degree angle. but we are going to be doing it with you sitting down. So
Okay.
now I'm going to check for a bruit in your carotid artery. And so what I want you to do is turn your neck this way. And then I want you to take a inhale, exhale, and then hold your breath while I, not yet, while I listen. When I begin to listen.
Okay.
And I'm going to be listening through my the bell. So now you can go ahead and turn your neck and then just take in a deep breath, exhale, and then hold your breath.
Okay.
Okay, so I want you to take an inhale, exhale, and then hold your breath.
Okay.
Okay, you can release now, and I'm going to do the same thing on the other side. Okay, you can breathe now. And there was no carotid bruit detected bilaterally. Now I'm going to, actually forgot to, oh no. Now I'm going to palpate for your carotid artery. Okay, carotid artery was 2+ bilaterally, which is the expected finding. And now I'm just going to inspect your precordium, which is your chest. And I don't see any heaves or lifts. And I'm going to go ahead and palpate your precordium, and I'm going to be palpating your aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and now I'm going to actually listen using my diaphragm. Okay, and I did notice that the S1 was greater at your apex and S2 was greater at the base of your heart, of your chest, I'm sorry. And now I'm going to listen again, but I'm going to be checking for any extra heart sounds for S3 and S4. But instead of using my diaphragm this time, I'll be using my bell.
So was that good or bad?
That's good. Aortic. Pulmonic. Erb's point, tricuspid, mitral. Okay, there was no extra heart sounds detected, so no S3 or S4 detected. And I also actually forgot to mention your apical impulse and which would be detected upon your mitral. So I want to see if I can feel for light tapping, which that was detected, which is a normal finding. So that concludes the cardiovascular portion. Now we're going to move on to the peripheral. So I'm just going to have you extend your arms for me. Okay, skin looks consistent with ethnicity throughout. And now I'm just going to palpate or check your temperature. Okay, temperature is warm, which is an expected finding. And now I'm going to palpate for for edema. Okay, you can put your hands down. No edema detected. Now I'm going to and I'm going to check for capillary refill in your fingers. So if I can. Okay, there was capillary refill in under 3 minutes. There was capillary refill within 3 seconds. Now I'm going to have you place your fingers like this to check for any clubbing. For each finger, I want you to do it for each matching finger. Okay. 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 Okay, and then your thumbs, please. Okay, so there is no clubbing in fingers, which is an expected finding. Now I'm going to move on to the lower portion of your lower extremities. So I'm going to do the same thing. I'm just gonna, if you can just reach out your legs just a little bit. Extend your legs, I'm sorry. So skin for both of them, please. Skin looks to be consistent. Skin color looks to be consistent. I'm going to be checking for temperature. Temperature is warm, and I'm going to be checking for edema, palpating for edema, no edema. And now I'm going to be doing the same thing with your toes. You can put your foot down. Now to check for capillary refill. Okay, capillary refill is within 3 seconds, which is an expected finding. And that will conclude this portion of cardiovascular and peripheral assessment. So I'm going to be checking for your radial pulse and for your pulses in your extremities. Okay, 2+ bilateral, or actually 2+ on. Okay, 2+ bilaterally for your radial pulse. Now I'm going to be checking for your great toe, which is your dorsalis pedis. Okay, 2+ bilaterally for your great toe. Now we're going to be looking for your ankle pulse, the pulse in your ankles. Okay, and 2+ bilaterally, which is expected finding. Now we will be doing the abdominal portion of your assessment, and I'm just going to, is it okay if I expose your stomach?
Sure.
Okay, now I'm going to just inspect your stomach, and it looks like your stomach is, there's no protrusion or concave. It looks round, which is an expected finding, a normal finding, and I'm going to listen for your stomach sounds. And I'm going to begin listening in your right lower quadrant and then move clockwise. So I'll do your right lower quadrant, your right upper quadrant, your left upper quadrant, and then your left lower quadrant. Okay. And I'm going to listen to each quadrant for 1 minute. Okay, your vowel sounds were normal active, and that is an expected finding. Now I'm going to percuss your abdomen, and we're going to be checking for tympani throughout the majority of the abdomen. The only time that we will hear something other than tympani will possibly be in your right upper quadrant, which is where your which is where your liver is, or possibly around your spleen. Okay, so tympani was detected. Now that we've now that we have percussed your abdomen, now I'm going to palpate. I'm going to begin with superficial palpation, just to check, to feel for anything, and then I will then do deep palpation, which is to see if we can detect any inflamed organs. So. Okay, upon palpation, I didn't feel any lesions or lumps or any tumors. Now I'm going to palpate for any lung inflammation. Any organ inflammation. Okay, upon palpation, there was no inflamed lungs detected. And I also forgot to mention when I was in inspection, your skin color is consistent with your ethnicity, and there's no protrusion in your umbilicus, no signs of hernias, etc. Now, this concludes the abdominal portion of your assessment. I'm going to now help you up. Thank you very much for being my patient today. Do you have any questions?
Everything is normal, right?
Yes.
Thank you very much.
You're welcome.
That's the question I have.
Thank you, sir.